Do you know that there can be a dangerous condition in your brain that can completely turn your and your loved ones' lives upside down? Imagine if suddenly in the middle of the night, someone wakes up and doesn't understand where they are, what time it is, and who the people around them are. This terrifying experience can shock you too. So friends, get ready to embark on a journey of information that will astonish you. Without any delay, let's get started. Today, we will talk about a health issue that is very important to understand: delirium. It is a condition that affects your mind and can be very challenging for you and your loved ones. Let's start without any delay. Firstly, we will look into what is this? How many types are there? What are the symptoms? What causes it? What are the treatment options? And finally, the conclusion. First, we will understand what is delirium. Let's see. Delirium is a condition in which a person's ability to think, focus, and be aware is temporarily affected. People feel confused and cannot understand the things around them. Like a man suddenly waking up at night and not understanding where he is, what time it is, and who the people around him are. Everything seems new and strange to him. I hope you now have a bit of an idea about delirium. Let's move on to the next point where we will learn about its types. Let's look at its types and understand them one by one. There are three main types of delirium: hyperactive, hypoactive, and mixed. First, hyperactive delirium. The patient is very restless, talks a lot, and can sometimes be aggressive. Like, a child was admitted to the hospital with a fever. At night, he suddenly started screaming loudly and hit the nurse. He did not understand why he was in the hospital. Second, hypoactive delirium. The patient becomes very quiet, speaks less, and responds slowly. Like an elderly woman was brought home after surgery. She stopped talking and just lay in bed. When her family members asked her something, she only responded with a gentle yes or no. Third, mixed delirium. The patient sometimes shows hyperactive and sometimes hypoactive symptoms. Like, a man was admitted to the hospital. Sometimes he became very restless and talked loudly, and sometimes he became completely quiet and confused. Friends, these were three main types of delirium. Now let's move to the next point where we will learn about its symptoms. Delirium has many symptoms, but in this video, we have covered some common ones. Symptoms of delirium, such as confusion. The patient has difficulty understanding things and making decisions, leading to disorientation. Next, difficulty in concentration. The patient finds it difficult to focus on any task or conversation. Next, memory loss. The patient forgets recent events or important information and repeats the same things again and again. Next, hallucinations. The patient sees or hears things that are not actually there. Next, disorientation. The patient gets confused about time, place, or people, not knowing where they are or who the people are. Next, restlessness. The patient constantly feels uneasy and keeps moving around. Next, speech and language difficulties. The patient cannot form clear sentences and has difficulty understanding spoken words. Next, mood swings. The patient's mood changes rapidly, such as becoming anxious or sad within moments. Next, sleep disturbances. The patient's sleeping pattern is disturbed, such as waking up frequently, having trouble sleeping, or staying awake at night. So, friends, those were some common symptoms of delirium. If you have information about any other symptoms, please write them in the comment box. Now, let's move on to the next point. What are the causes of delirium? Let's see. There can be many causes of delirium, such as severe illnesses or infections that deeply affect the body and mind. This problem is especially seen in elderly people after surgery. Side effects of medications, especially when the patient is taking multiple medications, it can also be a major cause of delirium. The effects of quitting alcohol can also lead to delirium as the body tries to suddenly get out of the habit of alcohol. Additionally, dehydration can cause delirium because the body and mind need enough water to function properly. These were some common causes. Now let's move on to the important points, where we will learn how it is treated. Delirium can be treated in several ways. Let's see. The treatment of delirium depends on its cause. First of all, the cause that is producing delirium is treated, such as a man had a fever and was experiencing side effects from medications. The doctor changed his medication and treated his fever. Gradually, his delirium started to improve. His family took care of him, explained things to him, and created an environment where he felt comfortable. Methods to treat delirium. First, supportive care. The role of family members and nurses is crucial. It is important to make the patient feel safe and comfortable. Second, medications. Sometimes doctors prescribe medications that help control the symptoms. Friends, these were the methods to treat delirium. If you feel any point was missing in this video, please do let us know in the comments section. Finally, let's look at the conclusion. Friends, delirium is a serious condition, but if we understand it and treat it on time, the patient can recover. If there is someone around you who is going through this condition, help them, understand them, and seek appropriate medical assistance. Thank you for joining us today to learn about delirium. It's important to stay informed and support those who are affected by this condition. If you found this video helpful, please like, share, and subscribe to our channel for more informative content. Stay healthy and take care of each other. See you next time. Thank you.